If you've taken the time and trouble to find this video, you're probably searching for answers. You know a child who may need help, but you don't know where to turn. The child may be withdrawn or very anxious and disrupts the family's life. He or she may be overactive and doesn't respond to traditional parenting, or they may be having consistent behavioral problems at school.
Sometimes these problems can be a result of stressful situations, such as a death of a family member, divorce or other separation, a high level of stress in the family, or a move. But it could be the child is suffering from a mental health problem. And please, don't let these words scare you. Mental health problems can be a serious condition that disrupts a person's thinking, feeling, mood, and ability to relate to others.
You may be feeling somewhat uncomfortable about facing a problem like this. Questions may come to mind, such as, am I overreacting? Is this just a phase? If I seek help, am I just going to make things worse? What can I expect?
First of all, understand that you're not alone. Mental health problems affect 1 in 5 children and teenagers. That's 20% of kids. It touches people regardless of the neighborhood they live in, their parenting skills, IQ, education, race, or income.
Although mental health problems are common, they can be harder for parents to figure out than a medical condition like a broken bone or a sore throat. But a mental health problem is a real health issue, and it needs immediate attention, just like a broken bone. These kids have trouble functioning normally in family, school, and social settings.
And all the good intentions and efforts of their parents just don't seem to be helping. Sometimes the behavior of a child makes the issue very apparent, like those who are overactive or act out in obvious ways. But many are more difficult to detect, like those who withdraw or suffer inside.
And we know that many kids with mental health problems are at risk for resorting to destructive behavior to cope with their problems. A child or teenager's mental health problem won't go away with time. It may greatly limit the child's chance to succeed in life, and it can lead to destructive behavior.
The important thing to remember, just like any other medical condition, it can be assessed, diagnosed, and treated successfully. 70 to 90% of individuals treated have significant reduction of symptoms and improved quality of life. The earlier the problem is addressed, the better the chance to succeed.
So what do? How do you take the first step? Talk to people who are knowledgeable and have experience with mental health problems in children and teenagers. A good place to start is with your family doctor or your child's school counselor. Find people among your friends and family who will encourage you in this path, preferably someone who has similar experience with their child. You probably won't have to search too far. Find out what your insurance covers. Most private insurances, Medicaid, and TRICARE cover some level of care, but they can vary.
If you don't have any coverage, there are still a number of ways to get help in our community. Research the available providers and treatment options. Then, call to schedule an evaluation for your child. A mental health evaluation is a way to find out what's going on with your child before committing to actual treatment.
During the evaluation, you'll have a chance to talk to a professional about your child's specific situation. Based on the results of the evaluation, the professional will recommend an individualized course of treatment. The treatment should be based on the severity and uniqueness of the child's problem. Children with less severe symptoms can be treated on an outpatient basis. The child stays in their school and home environments and visits a professional on an ongoing basis. With partial hospitalization, otherwise known as day treatment, the child receives intensive treatment at a campus facility and returns home every evening. In the most severe cases, full-time hospitalization may be recommended. The main thing for parents to remember during this process is to remain involved and in control.
While those providing treatment are experts in mental health, you are the expert in knowing your child. You and your family members are a vital part of your child's treatment. During the evaluation process, strive to find the right fit between you, your child, and the therapist or psychiatrist. It's important that you feel comfortable and trust their abilities.
Be open to the suggestions of the professionals. Be patient, but be persistent. This process will take time.
But most of all, stay hopeful. As difficult as it may be to take the first step, remember that nothing is worse than doing nothing.